Hello class, welcome to the lecture on Chapter 1, EMS Systems. After you complete this chapter and the related coursework, you will understand the scope and goals of the Emergency Medical Responder Training and the structure of emergency medical care delivery systems. The emergency medical responder's roles, responsibilities, and relationship to the emergency medical services or EMS system are explained, and a description of the levels of EMS providers is included. The importance of medical oversight is also stressed in this lesson. An emergency medical responder, often referred to as an EMR, is often the first medically trained person to arrive on the scene of an emergency. The initial care you give as an EMR is essential because it is provided before more advanced emergency medical care and could mean the difference between life and death. Your initial care is usually followed by care given by an emergency medical technician or EMT, paramedics, nurses, physicians, and other allied health professionals. Now let's talk about the EMS system. All agencies and personnel need to share a mutual understanding of their roles for an EMS system to operate smoothly. Close cooperation, careful planning, and continual effort are needed. To best understand the EMS system, follow the sequence of events as an injured or ill patient moves through the system. The figure here is a figure of the EMS system. Take a minute and look at it. Reporting. A report of an incident activates the EMS system. An emergency response communication center or public safety answering point, also known as a PSAP, usually receives a telephone call reporting an incident. Enhanced 911 centers use computers to determine the location of landline telephones. Here's a picture on slide 4 of a person reporting an emergency. Dispatch. Appropriate equipment and personnel are dispatched to the scene. Dispatch may occur by landline, telephone, cellular phone, pager, public safety radio system, computer, or other means. Agencies, personnel, and equipment that are involved in the first response vary by community. This figure here on slide 5 is a picture of an emergency response communication center that receives a call. First response. Firefighters or law enforcement personnel are likely to be the first on scene. Most communities have many EMRs, but few EMTs and even fewer paramedics. The EMR is a key element in providing emergency care. The figure here at the top shows firefighters and law enforcement personnel, and the bottom are EMRs in many emergencies. EMS response. An ambulance staffed by EMTs or paramedics is the patient's second contact with the EMS system. A properly equipped vehicle and the EMT staff make up a basic life support or BLS unit. EMTs stabilize the patient's condition and prepare the patient for transport. In addition to BLS services, patients may receive advanced life support, known as ALS services, from paramedics. ALS personnel can administer intravenous fluids and certain medications and monitor and treat heart conditions with medications and defibrillation. Defibrillation is the administration of an electric shock to the heart of a patient who is experiencing a highly irregular heartbeat, known as ventricular fibrillation. Defibrillation may also be done by specially trained EMTs and EMRs. Paramedics are also trained to place special airway tubes, endotracheal tubes, to keep the patient's airway open. All skill levels are based on what is learned in the EMR course: airway maintenance, bleeding control, prevention, recognition, and treatment of shock, The EMS system also involves law enforcement, fire protection, specialized rescue, and patient extrication. Hospital care. The hospital emergency department is the patient's third contact with the EMS system. It may be necessary for the patient to be transported to the closest appropriate medical facility first for stabilization, and then to a hospital that provides specialized treatment. Specialized treatment facilities include trauma centers, spinal cord injury centers, hand centers, cardiac centers, stroke centers, burn centers, pediatric centers, poison control centers, perinatal centers. Make sure to follow your local patient transportation protocols. Public health and EMS. It's important for EMRs to understand the basic functions of public health agencies because EMS personnel need to interact with public health practitioners. Let's talk about the responsibilities of public health departments. They include monitoring restaurant cleanliness, conducting immunization programs, determining the incidence of contagious diseases such as influenza, tuberculosis, and hepatitis, preventing the incident or progression of diseases. Because prevention is better than treatment, public health and public safety departments provide education and screening programs to help prevent injuries and illness. Car seat installation programs, programs to encourage seatbelt use, alcohol awareness programs, programs to encourage bicycle and motorcycle helmet use, blood pressure screenings, diabetes screenings. Public health departments provide support to EMS in certain situations. Now let's talk about the history of EMS. EMRs should have some understanding of the history of EMS. Many advances in civilian EMS have followed progress initially made in the military medical system. In the United States during the 1950s and 1960s, funeral homes, hospitals, and volunteer rescue squads provided most of the ambulance services. The only training available for ambulance attendants was basic first aid. Some physicians recognized that civilian pre-hospital medical care lagged behind military emergency care and urged the National Academy of Sciences to investigate. In 1966, Accidental Death and Disability, the Neglected Disease of Modern Society was published. This paper described the deficiencies in emergency medical care. It recommended the development of a national course of instruction for pre-hospital emergency care personnel. In early 1970s, the U.S. Department of Transportation developed a national standard curriculum for training EMS providers. During the 1980s, the use of advanced life support, ALS, within EMS became common. Today, EMS providers are trained through standardized courses conducted at accredited training centers. There are 10 standard components of an EMS system. The National Highway Traffic Safety Administration, known as the NHTSA, of the Department of Transportation evaluates EMS systems based on 10 criteria: regulation and policy, resource management, human resources and training, transportation equipment and systems, medical and support facilities, communication systems, public information and education, medical direction, trauma system and development, evaluation. Here's a word about transportation. EMRs assist more highly trained EMS personnel in treating and preparing the patient for transportation. 3 terms are used to describe proper patient transportation to an appropriate medical facility. Transport. A patient's condition requires care by medical professionals, but speed in getting the patient to a medical facility is not the most important factor. Prompt transport. A patient's condition is serious enough that a patient needs to be taken to an appropriate medical facility in a fairly short period of time. Then we have rapid transport. This phrase is used for the few cases when EMS personnel are unable to give the patient adequate life-saving care in the field. An appropriate medical facility may be a hospital, trauma center, or medical clinic. EMS personnel must work closely with their medical director to establish transportation protocols that ensure patients are transported to the closest medical facility, capable of providing adequate care. The figure here on slide 18 shows an ambulance transport to a hospital or medical facility. EMR training. An EMR course will teach you how to examine patients and how to use basic emergency medical skills. The skills and knowledge learned in this course provide the foundation for the entire EMS system. This figure here on slide 19 is a typical emergency scene with injured patients. These skills are divided into two main groups. Skills needed to treat injured trauma patients, such as controlling airway, breathing, and circulation, controlling external bleeding or hemorrhage, treating for shock, treating wounds, and splinting injuries to stabilize extremities. Skills needed to care for patients experiencing illness or serious medical problems include heart attacks, seizures, problems associated with excessive heat or cold, alcohol and drug abuse, poisonings, bites and stings, altered mental status, behavioral or psychological crisis, emergency childbirth. Let's discuss the goals of EMR training. The basic goals of EMR aim to teach you how to evaluate, stabilize, and treat patients using a minimum of specialized equipment, how to improvise, how to help EMTs and paramedics when they arrive on scene. Know what you should not do. It may be better to leave the patient in the position in which he or she is found rather than move the patient without proper equipment or an adequate number of trained personnel. Never judge patients based on their cultural background, religion, color, gender, sexual orientation, age, or socioeconomic status. Know how to use your EMR life support kit. This course will teach you to treat patients using limited emergency medical supplies. An EMR life support kit should be small enough to fit in the trunk of an ambulance or on almost any police, fire, or rescue vehicle. Although the contents of the kit are limited, such supplies are all you need to provide immediate care for most patients you will encounter. This figure here, shown in slide 26, are some suggested contents of an EMR life support kit. Know how to improvise as an EMR. You will often be in situations where little or no emergency medical equipment is available. It is important to know how to improvise. Examples of improvising are: use articles of clothing and handkerchiefs to stop bleeding. Use wooden boards, magazines, or newspapers to immobilize injured extremities. Know how to assist other EMS responders. Many procedures that EMTs and paramedics use cannot be performed correctly by fewer than 3 people. You must have to assist with these procedures, and you must know what to do in such cases. You might need to learn some additional skills. EMRs operate in a variety of settings. Problems encountered in urban areas may differ sharply from those found in rural settings. Regional variations in climate create conditions that affect the situations you will encounter and require you to use different skills and equipment in treating patients. Certain skills and equipment in this book are beyond the essential minimum knowledge level required for an EMR course. These supplemental skills and equipment may be required in your local EMS system. Now let's talk about roles and responsibilities of an EMR. As an EMR, you have several roles and responsibilities. They include maintain your body in a healthy physical and mental condition, maintain equipment in a ready state, respond promptly and safely to the scene of an accident or sudden illness, ensure that the scene is safe from hazards, and above all, protect yourself and your partner and the patient. Protect the incident scene, okay, and protect your patients from further harm. Summon appropriate assistance such as EMTs, fire department, or rescue squad. Gain access to your patients. Perform patient assessment. Administer emergency medical care. Provide reassurance to patients and family members. Move patients only when it's necessary. Seek and then direct help, okay, from bystanders if necessary, and control activities of the bystanders, and be prepared to assist EMTs and paramedics as necessary. Maintain continuity of patient care, document all the care that you give on scene, and keep your knowledge and skills up to date. The importance of documentation cannot be understated. Documentation should be clear, concise, accurate, and according to the accepted policies of your organization. Your documentation should be clear of spelling errors, and you should be able to use proper English, punctuation, spelling, and syntax. This documentation is important because you will not be able to remember the treatment you give to all patients. It also serves as a legal record of your treatment and may be required in the event of a lawsuit. It provides a basis to evaluate the quality of your care given. Documentation should include the following items: the condition of the patient when found, the patient's description of the injury or illness, the initial and later vital signs, the treatment you gave the patient, the agency and personnel who took over treatment of the patient, and other helpful facts. I want to touch a little bit about attitude and conduct. As an EMR, you will be judged by your attitude and conduct. Professional behavior has a positive impact on your patients. To be a good EMR, you need to reflect certain characteristics, such as be honest and conduct yourself with integrity. Be aware of the patient's feelings and have empathy for your patients. Be motivated to get the job done and understand the limits of your training and skills. And be an advocate for your patients. It's going to be important for you to remain calm and caring, avoid, embarrassing your patients, and help protect their privacy. Talk with your patients and let them know what you are doing. Medical information about a patient is confidential and should not be discussed with your family and friends. Your appearance should be neat and professional at all times. This figure here on slide 35 is a picture of a professional attitude and neat appearance, that helps reassure the patients. Now we're going to get into discussing medical oversight. The physician or medical director is the overall leader of a medical care team. Each EMS agency should have a physician who directs training courses, helps set medical policies and procedures, and ensures quality management of the EMS system. Medical oversight is also known as indirect or offline medical control. A second type of medical control is known as direct or online medical control. Online medical control is provided by a physician who works in contact with pre-hospital EMS providers, usually paramedics or EMTs, by two-way radio or wireless telephone. In cases where large numbers of people are injured, physicians may respond to the scene of the incident to provide on-scene medical control. Quality improvement. Quality improvement is a process used by medical care systems to evaluate the effectiveness and safety of current treatments and procedures. It is also used to determine the effectiveness and safety of new treatments and procedures. The Institute of Medicine has identified 6 components of a quality improvement process. They are: safety. The actions of EMRs must not cause harm to patients, bystanders, or EMS providers. Effectiveness. EMS care should be based on scientific knowledge and provide the desired benefit to the patient. Patient-centeredness. Be responsive to the patient's physical needs as well as his or her values, religion, and heritage. Timeliness. Provide care in a timely manner. Efficiency. Always strive to deliver care without wasting supplies, equipment, or time. Equitability. Patient care should not vary between people of different genders, sexual orientations, ethnic backgrounds, geographic locations, or socioeconomic levels. Your certification, as an EMR. Certification is the process by which a person, institution, or program is evaluated and recognized as meeting certain standards to ensure safe and ethical patient care. Once certified as an EMR, you must follow the national or state standards for your local level of practice. Your employer may set additional requirements for your conduct and practice. It is going to be your responsibility to make sure that you keep your certification current by maintaining continuing education requirements and keeping your skills up to date. Failure to keep your certification current can result in penalties. Let's summarize Chapter 1. The EMR is often the first medically trained person to arrive on the scene. The initial care provided is essential because it is available sooner than more advanced emergency care and could mean the difference between life and death. EMRs should understand their roles in the EMS system. The typical sequence of events of the EMS system is reporting, dispatch, emergency medical response, EMS vehicle response, and hospital care. The 4 basic goals of EMR training are to know what not to do, how to use your EMR life support kit, how to improvise, and how to assist other EMS providers. As an EMR, your primary goal is to provide immediate care for the sick or injured patient. As more highly trained personnel, EMTs or paramedics, arrive on scene, you will assist them in treating and preparing the patient for transportation. Once your role in treating the patient is finished, you must record your observations about the scene, the patient's condition, and the treatment you provided. Documentation should be clear, concise, accurate, and in accordance with the accepted policies of your organization. Medical information about a patient is confidential and should be shared only with other medical personnel who are involved in the care of that particular patient. The overall leader of the medical care team is the physician or medical director. To ensure that the patient receives appropriate medical treatment, it is important that EMRs receive direction from a physician. Quality improvement helps to determine the level of care rendered by an EMS service. It measures care in 6 component areas: safety, effectiveness, patient-centeredness, timeliness, efficiency, and equitability. EMS systems should have an ongoing quality improvement program. All right, class, let's conduct a little bit of a review here in the form of a multiple choice check for learning. Here we go. Question 1. The EMR must possess the ability to A, treat patients using limited equipment, B, ALS level skills, C, keep severely injured patients alive for extended periods of time, or D, diagnose conditions in the field. If you chose A as the correct answer, you are correct. Treat the patients using a limited amount of equipment. Question number 2. For a patient in cardiac arrest, which of the following interventions will you most likely be responsible for performing? A, administration of pain medication, B, CPR and defibrillation, C, intravenous therapy, or D, intubation. If you selected B, you selected the correct answer. You would be responsible for performing CPR and defibrillation. Question number 3. When EMTs or paramedics arrive at the scene of an emergency, the EMR should A, cease all patient care, B, prepare to accompany the patient to the hospital, C, assist the higher level EMS providers in continuing care, or D, obtain signatures from all other EMS providers. If you chose C, you chose the correct answer. You are to assist the higher level EMS providers in continuing care. Okay, class, this concludes the lecture on EMS systems in Chapter 1. If you have any questions, please feel free to contact me via email at jbreakbill@riohondo.edu, or write the question down and bring it to the next class meeting so we can discuss it in class. Or you can feel free to post it on a discussion board, and we'll let other class members get into our discussion regarding your question. Thank you for your time, and we'll see you next class meeting.